First of all, welcome everyone for participating into this session of the success stories of different candidates who have given their exam in recent days. Okay, among them, Dr. Alum was our course candidate, and Dr. Alum was an excellent candidate, but unfortunately, he was like sick, and he missed my mock sessions and the course classes in the very last days. So I called Dr. Alom, like what happened to you, and he said like he's very sick, he couldn't appear to his exam maybe. So I said like, okay, just you go and appear your exam, because I know you are going to pass. Okay, and Alhamdulillah, after the result, he called me and he said, I passed. Okay, so this is very nice. So now, Dr. Alam, it's all about you. Please let us know about your story.
Well, as everyone already know, the Dr. Atik said, I had to go through some physical problem. To long story short is, for last 8 months, I had to go through 3 surgeries. And the last surgery is just after the day of my Part B exam. So it's nearly 1 month. That's it. So I don't think nobody's going to want to hear this kind of thing. But let's start with most frequently asked question probably. When I used to be a candidate and when I have those questions in my mind and I actually listen to this kind of session. So one of the most common question I always have, does anatomy picture is going to be enough?
Yeah.
The thing is, you just have to go through the notes and you will have an orientation of the picture and you will do excellent in the exam. You will have the idea and you can go through the picture. You will not get the exact picture, but you have the idea and you can answer. It's as simple as that. I did not follow any other notes apart from Dr. Atik's note, and also I did not go through any other courses. I could not do any hands-on due to my physical problem. And just this thing is the knowledge part. I think note is just enough if you go through the note, but revision is very important because MRCS is, I think, a revision-based exam because it's question answer. There are no absolute concept in a particular things. You have some question and you have some answers. So if you are going to not revise, then you have the tendency to forget this kind of question after 3 to 4 days or 7 days. So you have to keep revising the knowledge part actually. And for the skill part, there are 2 things actually. For knowledge part, keep revising, and for the skill part, keep practicing. If these 2 things people can follow, I don't think this is a much tough exam, but there are some common sense is necessary for the exam days because something actually we are not oriented because it's a very structural and internationally standard exam. So if you are going to panic, it will be very difficult to get rid of the station. When I started to the knowledge part, I see 2 or 3 questions if you miss due to missing the revision part, then you actually start to panic how I'm going to perform the later part. Then you can't answer the answer you already know. So this kind of things happen, and you can only avoid this kind of thing by keep revising. All the questions are from notes. There are no news station. Will not be any news station in any other center where if their exam is outside the UK, there will never be a news station because the regulation is like that. The news station, if come, it will come in UK first, then it will go outside.
Correct.
So there will be no news station. So you don't have to panic that what if I have a news station? You don't have to actually. And for the skill part,
Dr. Alam, I'm just interrupting you.
No problem,
like
please.
if I'm not wrong, you gave your exam in Chennai Center, right?
Right. Chennai.
Correct. And the Chennai Center was having the lowest passing rate in the near future. It was like they were setting result for all of the candidates. Okay, so I want to know about your score. What was the score? I know already, but I want to know all of the people they get to know about it. Please share your score.
In knowledge part, I get 137, and in skill part, I got 134.
Excellent. Excellent. Okay, so the problem was in the skill part, there was one station that all the candidates had the similar problem, one not tying station, right?
I could not complete the not tying station. I know
Yes.
why I
Okay.
could not
So
complete
what
it.
was the problem actually?
I don't know, because not tying station is very easy and it is very
Yes.
2 to 3 minute station actually.
Correct.
But
Correct.
I think the teacher or the examiner who was there, he was not properly oriented of the station. So
Hmm.
he delayed all the candidates, and he when you gave the first the riff knot, then he started to ask the question very slowly. Then he said, okay, now go for the second knot. Then again he started to ask question, and so it is actually time consuming. If he asks to do all 3 knots fast, then we'll ask question, then it will be easy. But I think the teacher on the first day, actually it happened. On the second day, it did not cause any problem to the candidate, but the first day it was Korean or Chinese examiner, probably, I don't know.
Hmm.
He was a bit slow, and probably every every of our candidates was suffered due
Right.
to him,
So,
I
so the
think.
thing is, from my course, all the candidates, almost who couldn't make it through, I'm really feeling sorry for all of those. But they passed in the knowledge part, but they failed in the skill part for maybe 1 mark or 3 marks. Some of them, 6 marks. Okay. So
In
there
Chennai,
was.
I think 80 to 90% failed in skill part.
Yes,
Those who
yes.
failed.
So almost 17 people gave their exam from our course, right? So three or four of them failed, and just they failed just one for one, three, four, or someone had like six, okay, like that. So all of them had the problem in the skill part. So maybe the examiners they take your exam in the skill part, was that so much hard? But you got lots of marks in that, right? So
Ah,
ex- please share your experience, because all the candidates will have their exam in future, right? So
right,
give your
right.
own views about that.
So regarding the exam day scenario, a lot of people panicked about the dress code. So at first,
Hmm.
don't think about the dress code. Just go for formal dress. You don't have
Hmm.
to think other thing.
Hmm.
And the Edinburgh examination is very organized. You don't have to think any other things, or how what instrument you need. Nothing is needed. Just
Right.
go, sit. They will take your passport and start the queue in serial. Just as simple
Hmm.
as that. And I started with the knowledge part actually. And there are 22 candidates in first day, first in morning session,
Hmm.
and there are 22 station. 17 station is there, and 2 station is for preparatory station for communication. So 19 and 3 rest station.
Hmm.
And in knowledge part, I started with critical care. It's just as simple as that. You go, they ask some few questions from checklist, all in the notes. And if you know, you can answer. If you don't, you can't answer. It's as simple as that. In knowledge part, it is just keep revising the note, because you can't do anything else. In skill part, you can do a lot of acting also. You forgot a step, you can do other things. But in knowledge part, if you don't know the answer, you can't answer. So revision, I always say, is keep revising and keep stick with one notes and keep revising the same thing, because you will forget 3 to 4 days after whatever you are going to read.
Yes. Okay. Tell us, how many times did you revise
I think 5 to 6 times probably.
before your exam, and how many days you took for your full
The
preparation?
thing is, I passed my part one in January, this January.
Right. Right.
Then February, I enrolled in your course.
Yes.
Then I started to prepare February, March, April, probably these 3 months I prepared well. Then May, June, I could not even study properly. I could not attend even mock, you know
Yes, I
that.
know. Yeah, that's why I
I,
called you.
so I had to go through a lot of problems there at that time. So the preparation was not the way I wanted in the last 2 months before the exam. So at first the preparation was well. I attended every mock. I always think
Yes.
that it is I think it is very good if you make the mistakes in mock, then you need exam, because uh, do whatever do in your mocks. Go for mocks, please. Keep practicing in mocks. If you have the fear to participate in mocks, then you can't actually perform in the real exam.
Correct. Correct.
It is important. As you know, I always try to attend the mock, but the later part,
Yes.
later in the third or the courses after our courses, I saw that a lot of people are actually very much interested to attend the mock, and even it was difficult to get a slot. But our times, it was not that difficult. Even there are slots are free. So I even attended
Yes.
2 or 3 mocks in the same day. I
Yes.
always keep reminding that whatever mistake I'm going to make, I'm going to make with Dr. Atik, but not in the exam.
Good. Good. No, like during the mocks as well, I always say you just like a bullet. So you did that very nicely. Very,
So
very
the knowledge
nicely.
part, so the exam days, the knowledge part is simple as that. Anatomy picture, as I said, you have to go through the notes, you have the idea, and you can answer actually. It's like Dr. Samira said, if you see the Shah Rukh Khan 10 times in 11 times
Yes.
best show you a different picture, you will know that he's Shah Rukh Khan, right? So that's how it works. Skill
Yes.
part, I felt I was messed up. Actually, our day, everyone messed up in our skill part. And even in Chennai, I think everyone messed up. I forgot to wash in all 3 clinical examination. I forgot to wash my hand. And in abscess drainage, I had molestation at first abscess drainage. So that was, I did well, I think. But not tying was a disaster for everyone. So do I. Then history and communication is just I follow Dr. Ratik's 10 steps in history. And communication is as simple as that, that just go through the notes. The same question they are asking, you have to just answer it. But professionalism and communication skills are very important here because in angry wife, your tone really matters. How you approaching the angry wife or anxious mother, your tone, I think, important. How you,
Yes.
let's say,
How you react, how you act with the
how you
patient,
how you act
right?
the
How
patient.
professional you are. Yes.
When you offer a painkiller, can I give you a
Correct.
painkiller?
Right.
And if your tone is not right, and they will mark, I
Exactly.
think that whether the
Exactly.
empathy is there or not. So those are
Yes.
important. But in clinical examination, that's also all the patients are real nowadays. Varicose vein station was there, hydrocele, and in hydrocele, I actually messed up in clinical examination because as I forgot to wash hand. Also, the patient was maybe 150 kg weight patient, varicose vein, and I was going to do that tourniquet test.
Mhm.
I took legs, but I could not tie
Lift.
that tourniquet. But
Hmm.
someone helped me. I think
Yeah.
they understand that the patient's weight. So mm, yeah, one of the important thing everyone said, I also am saying, don't panic. If you panic, you will make mistakes. A lot of mistakes is going to happen. So
Yes.
it is easy to say don't panic, but I think if you can practice a lot, you can overthrow this.
Yes. Thank you, Alom, for sharing your very beautiful story. In spite of you being sick, you did a tremendous job. Hats off to you. Okay. Very nicely
Ah,
done. You are, as always, just like a bullet. Okay. Please try to help. Try to help all the candidates who have their exam in future. If they text into the group or personally they text you, please try to help as much as you can. And congratulations for your future journey as well. Okay, if there is any questions you want to ask to Dr. Alam, Dr. Alam, I
yes,
think
yes, I
he will be
said that will
happy
be
to
very easy
give the
for me.
answers.
That will be very
Yes.
easy for me.
Yes.
So I
Anyone
got
has any
the in
question?
chat, all examiners Indian. No, there are mixed examiner. I think half are Indian and half are from British. It is half shirt. Yeah, I went with half shirt, but you can go with a full sleeve, but you have to fold it.
Yes, to till your
And
elbow.
what section did you feel difficult in the exam? Knowledge part was pretty straightforward for me. It was not difficult for me because the all station are common. But in clinical examination and also the skill part, I felt some difficulty due to lack of my practice. Actually, it's not about that. If I had more chances to practice, I could have been do more good in the exam.
So, Dr. Alam, I want to ask about that in varicose vein. You told that you forget to, you don't, you are not able to tie that tourniquet. So, how can we fix that tourniquet in exam?
Oh no, no, there will be an assistant for you. He will help. You just have to tell the assistant that, can you please help me to tie the tourniquet? He will assist.
Okay, okay, thank you. And another question, in varicose vein, will only do that only single tourniquet test, or we have to also do multiple tourniquet test?
I did multiple tourniquet test.
Okay, and potty test?
No, did not did the modified part test because sometimes people has to go through pain, and earlier
Yeah.
on one said that he's having pain, so we are not allowed to give the patient pain. So I actually, though in examination we learned that we have to go for part test, but I did not did it.
Okay, thank you. And there was also a Doppler in the station.
Yes, you have to do the doc.
Okay, and while doing the Doppler, we should do a Doppler in supine position or in standing position.
I did it in standing position.
Okay. Thank you so much for
But
your.
it's the Dr. Ivan, it's wise to do the Doppler in supine position because the venous flow will be much more and you can hear the sound much more louder. Okay, so it's wise to do the Doppler in supine
Right.
if possible.
I by mistake I did it in a standing position.
No, it's
Because
fine.
when you enter into the
Both are
examining
correct.
physical, a lot
Okay.
of
Yes,
things
both are
we are
correct.
going to forget.
Yes,
Because
both
in
are correct.
hydrocele, I can remember the trans illumination test. I have to do it in standing position, but I did it in supine position. So
It's
Yeah.
fine.
these kind of things happen.
Yes,
Yeah,
it's
Dr.
fine.
Alam, in case of like you told you have a case of hydrocele. In that, how can we do like fourth chaperone and all? How we can put make him comfortable during the examination.
Okay,
In,
that's very good question. The thing is, there will be always an assistant in clinical examination, but you have to say that I would like to have the chaperone,
okay.
and you have to tell it because there will be a tick mark for this.
Yeah.
And another thing is, you have to tell the patient, do you mind if I tell you to put off your clothes to examine your private part? You have to take the consent, obviously.
Yes.
And
Yes.
another thing is, before touching the genitalia, I also asked him, do you mind if I touch in your private part?
Okay. Okay. Okay, that's good. Thank you. Thank you so much.
Hi, sir. I have a question. Sir, what do you suggest for the last 10-15 days before the exam? And what do you suggest for the last 2 days before the exam?
Okay. Not really the right person to tell because I could not went through the proper preparation. But one thing I must say, you see, when you read in the knowledge part, you don't have to read the lining of esophagus in every day, right? You know already
Right.
it. So if you read it once or twice, you know. But when
Yes,
I
sir.
say the histology of parathyroid adenoma, we tend to
Right.
forget this kind of question. So what I did, I actually collect the hard copy of Dr. Ratik's note and I mark all those questions which I always tend to forget.
Okay.
And last 2 to 3 days, I actually went through those hard questions. I felt that I should go through this, like is there any other question?
Sorry, again, I would like to ask one question. In any station, if the patient is having pain, like we can do in the knee examination, if the patient is having the pain while doing the Harris test, and should we continue the another test after that, a special test? Should we there only?
I did not have the knee examination and I'm not sure about that, but I don't think if you have pain, you can't continue the examination. You have to stop and offer some help.
Okay, after helping up some help, like I would like to give some medicine and or I'll be as gentle as
Right.
possible. So would you like to continue the examination? Should we ask him or we have to stop there only?
You have to stop and ask for some help. And usually what happened is the examiner is told, please continue. So
Okay.
those are actually actors and
Fine.
they are not in real pain.
Yeah.
And when the examiner said, the actor actually pretend that there are no pain.
Yes. Okay. Okay. Thank you. Thank you so much.
Thank you.
All right. Okay. So anyone wants to ask anything? Hello? Is there anyone who wants to ask any questions to Dr. Alom?
So
So
another question I
it
got,
was a
hydrocele
particular
examination, wear
question.
gloves? No, you don't wear gloves in hydrocele examination. Dr. Atik keeps saying that in clinical examination, you are not going to wear any gloves, okay? Because you can't actually feel the temperature or something in gloves.
To be more specific, you are not allowed to wear any gloves in any clinical examination except you are examining the oral cavity.
Right.
In regard to knot tying, did they provide you gloves or did you do without gloves?
In first day, 21st July, when we give this Chennai examination, we have to wear gloves before entering the station. They will say that please wear the gloves. But I heard that in the next day, people go through the station with bare hands. I'm not sure about that, but we have to go through the gloves. The only problem with
Always you have to wear the gloves. Remember, all my course candidate, what I said is, in some of the centers, they will provide you the gloves beforehand. And in some of the centers, they will give you the gloves while you into the station itself. Okay. So it depends on the center, but try to wear the gloves. If you don't see any gloves anywhere, you ask for it.
yes, exactly. Sometimes they actually keep hiding this kind of thing. There are a mark for situational awareness for professionalism.
Okay, before we wear the gloves, do we wash the hands for those 3 knot tying stations or no need?
Dr. T, you already have these answers,
Okay, sir.
right?
As far as I know, because these 3 are atypical and doesn't need any WHO safety checklist, and
No,
that typical is not, since it's not typical station.
once you wash your hand and you wear the gloves, you don't have to change it for these
Yes.
3 successive stations. No need.
Yes, sir.
Dr. Alom, did you change your gloves?
No. We have to actually wear the gloves before entering the station,
Yes,
and you
yes.
keep the gloves after completing the station. So,
And do we start the knot tying only after the only after the examiner prompts you, or do you directly go there and start tying the knot?
no, you will enter, he will ask for your candidate numbers, and he will say that, did you read the stem? Do you want to go through the stem again? So do whatever it said. There will be some instruction is there.
Oh, okay.
Sir, I have a question, please.
Go ahead.
Sir, it's Dr. Sulaiman.
Yes, Dr. Sulaiman, please go ahead.
Sir, I would like to know that all the equipments like the torchlight or cone or stethoscope, which we should.
Everything will be provided into the center. You don't have to bring anything except your stethoscope and yourself and your passport.
Okay, sir.
And I would like to add one point. When you enter the examination or procedure station, please keep an eye on the table, because there will be a lot of things and you have to use everything. So there will be, if you miss something, there will be, you lose the mark. But the problem is, patient is on one side and table is another side. We are actually looking at the patient and sometimes miss some instrument. So please keep in mind when you enter the station. If they give you anything, you have to use it.
Okay, sir.
All right. Anyone else wants to ask anything? Dr. Yash?
Yeah, I would like to know how many other types of notes that can be asked in the procedure.
Dr. Yash, we cannot hear you properly.
What are the different types of knots that can be asked in the procedure other than the swapping?
It is a fixed station actually. You will have all those 3 knots will actually always fixed.
Okay, sir.
All right. Anyone else? Okay. So thank you, Dr. Alom. Thank you for sharing.
Thank you very much for all your, and I can say all the people who are hearing. I did not went through any notes or any other thing, as I said. I just followed Dr. Atik notes, and if you just follow him blindly, you are going to pass. And I also want to thank some course candidates, Dr. Sami, Dr. Farial, also Dr. Sonia.
Yes.
Dr. Sanjeev is not there though, but I can remember Dr. Isha, Dr. Udita, Dr. Nagendra, Dr. Richard, also Dr. Farhad sir.
Yes.
Those are my course mates, though I was not connected in the letter, but I can remember all of them, and I'm very much I got a lot of help from them. So I'm grateful to them also.
Very nice. Thank you, Dr. Alom.